Now, this part of the course is about complications, so it doesn't matter how experienced you are and how well you perform these injections, complications can still happen, and don't judge yourself for that. So there can be cases when you will see no effect following an injection. The most likely reason is that the medication was transported or stored in inappropriate conditions, and the result is that the Dysport may have lost its potency. The other reason, which is a lot less likely, that your patient might be a so-called non-responder. Some people are just immune to botulinum toxin. It is an extremely rare case. If your patient has tried botulinum toxin injections in the past and there was no effect, you should warn the patient that it can happen again. If you will get no effect after injection, it will surely be a surprise, but I just want to assure you that it's rare, but it's possible. Now, the other possible complication, which is a little more likely, especially if you didn't evaluate the patient correctly and you were injecting in the forehead, you might get the low forehead or a sunken forehead after the injection. This is the case where you might not notice the important warning signs: the deep wrinkles in the forehead, evening headaches, low brow position, and excess tissues covering the upper eyelids. The other possible complication, fortunately extremely rare, is difficulty breathing and swallowing right away after the injection. This is where you'll need to act immediately. It might be a case of an intravasal injection causing a systemic reaction. So the amount of Dysport that you will inject in one point is not enough to cause paralysis of the muscles involved in breathing. It's a very, very rare case, but if it happens, call the ambulance and stay with the patient until help arrives. Now, the other possible complications are headaches after the injections, but they usually disappear after a couple of months. There can be minor hemorrhages, but they usually disappear in approximately a week. The same as asymmetry, because there can be a disbalance of the muscles on both sides, and the Botox might take some more time to affect the muscle on one side and less time on another. It shouldn't happen if the injection was done properly, but if it does, don't be scared. The asymmetry should disappear in approximately a week. Now, generally about complications, I don't want to scare you with these examples, but if you are injecting botulinum toxin, make sure you have enough competence to deal with the unexpected. These situations are extremely rare, but possible.